What is Crimean Congo Hemorrhagic Fever, CCHF? Crimean Congo Hemorrhagic Fever is a common animal-to-human disease that begins suddenly. Several people have lost their lives to the disease, most often due to contact with animals or eating contaminated meat. The cause of this disease is a virus. Hyaloma hard tick is a carrier of the disease. The insect transmits the virus to the next generation through its eggs. Crimean Congo Hemorrhagic Fever carrier. 1. Ticks by biting or crushing it on open skin. 2. Vertebrates, such as livestock, dogs, rodents, hedgehogs and 3. Birds. They are indirect carriers, because they transmit ticks to other animals or humans. Symptoms of Crimean Congo Hemorrhagic Fever. 1. Latency period. Usually 1 to 3 days and a maximum 9 to 13 days. 2. The stage before bleeding. Lasts 1 to 7 days, including fever, weakness, severe headache, chills, severe pain in the back and legs, dizziness, bruising and anorexia, nausea and vomiting, unrelated to food eating, diarrhea, abdominal pain, etc. It should be noted that only some symptoms may be seen in a person. 3. Bleeding stage. Usually starts on day 3 to 5 of the disease and lasts 1 to 10 days. Bleeding in the mucous membranes and bleeding from the nose, gums, etc. are seen. In some cases, bleeding is not visible to the patient's caregivers, which is one of the causes of delay in diagnosis. Ways of transmitting Crimean Congo Hemorrhagic Fever. Infected tick bites or crushing on the skin. Contact with infected livestock, slaughter, shredding and cleaning, skin, blood and secretions. Consumption of fresh raw or undercooked meat of infected animals. Contact with the patient's blood and secretions and inhalation of polluted air. Ways to prevent Crimean Congo Hemorrhagic Fever. Personal protection when working in areas where there is a possibility, use of gloves, work clothes, boots. Avoid putting a knife contaminated with meat and offal in the mouth. Buy livestock and livestock meat from places that are hygienic. Do not take care of animals except in emergencies. Observance of hygienic principles in animal husbandry. Personal protection in contact with livestock. Do not separate the tick from the animal or human by hand. Rub the oil on the back surface of the tick. To stop it breathing, the tick gradually leaves the skin. The disease has no symptoms in infected animals, so we will not notice the disease from the appearance of the animal. Consume fully cooked meat. Store meat in the refrigerator or freezer for 24 hours after slaughter. Avoid liver consumption. Observance of personal protection in contact with the suspected patient, use of masks, gloves, glasses, guns.